Hello, my name is Laura Mosqueda, and I'm delighted that we can show you what the next phase of your training could look like.
Keck School of Medicine, we pride ourselves on challenging paradigms and thinking outside of the box.
The amount of exposure that we get as students at LA County and Keck and all these different sites is incredible.
The training you get here is as hands-on as it could be.
Good morning, Mr. Reed. Oh, do you have the CT scan?
Yeah.
Let's pull up that CT scan.
So this is the CT scan from the first day.
We take on the toughest challenges, the toughest cases. We take on the biggest questions for research to try and make a difference and improve human health.
We are smack in the middle of it all, right here in this health sciences campus. So we have a county hospital right across the street that has incredible, not only inpatient, but ambulatory facilities. Right across the street in the other direction, we have our Keck hospital with wonderful ambulatory and outpatient surgery sorts of facilities. Then on my right, we have our Norris Comprehensive Cancer Hospital. And then just across the street, we have our major research buildings too.
This one is unique because it's for cranioplasty.
Research and education are really the foundations upon which everything else at the School of Medicine is founded on. You have multitudes of opportunities to do bench work, clinical research, translational research, and really take your work from the bench side to the bedside.
Hello. Hi, Lauren. How are you doing? I'm well, thanks.
This week, in fact, we've had a sickle cell patient, an aplastic anemia patient who came for treatment. We get TTP patients. We have 3 to 5 autologous stem cell transplant patients on at any given time.
I've been here 44 years, and there's 2 common foundational principles. Number 1, patient interest supersedes self-interest. This is absolutely critical.
Your levels are coming down, looking good. So you're thinking discharge?
Yeah, I think you can go home today.
The second is that this is a teaching center, and we talk about the very famous professors that are here to teach you. But the one thing everybody learns is that the master teachers are the patients themselves.
And so, sir, we're going to show you what you actually had before and after. Okay? This is what you came in. That's what you came in with. Nearly locked out that entire lung, right? Yeah. Oh my gosh.
You must have a passion. Part of your mission is to take care of the underserved. We are serving the underserved. We are serving those that are more socioeconomically advantaged. But essentially, you want to serve everyone and everybody and serve them the same, regardless of who they are.
So who's our next patient? In here?
Yeah.
Yes.
These are the patients that, it's not just a pleasure to serve, it's an honor to serve.
They're my people. I see myself reflected in the population.
I really wanted to come back home in more ways than one. This could be my mom, this could be my dad, this could be my uncle. And no other place could afford me that opportunity besides here.
It's been the most challenging and rewarding thing I've done in my life, being here. I've been pushed in ways that I didn't think were possible.
We're looking for that spark in a person that's going to become a good physician who's going to put the patient first.
Can we get Dr. Dix in here, please? Can we get some backup?
No matter how dramatic this scenario is, it's something that happens.
Patient just went non-responsive, her blood pressure dropped. We are pretty much in the ORs from day one. We do cases that other places just read about in textbooks.
You really want to care for the caregiver. Our goal is to prevent burnout before it even happens.
Takes about 8 months till you start thinking, I can do this, I can master this.
Do you see anything worrisome at all? Anything new?
No, I don't.
This is not a movie, this is for real.
Can you show us 2 fingers?
It's really important that not only do they listen to what the attending has to say, But equally important, the attending needs to listen to what the resident has to say.
Show me where your pain is.
We're here to learn. There's no dumb questions ever. We really want an inclusive environment where you can be the thought and the change leader on our campus.
If you come to USC, you will be part of a close-knit, collaborative Trojan community.
It's so important to know that you're part of the Trojan family. That's not just a catchphrase here, it's something that we really mean. We care about the people who are here. We care about you after you leave. It's a lifelong commitment on our part.
Welcome, my name is Hannah Obasi. I'm a third year in internal medicine and pediatrics, and I'm representing the MedPeds program here at LAC USC. Our program is 4 years long. There's 6 residents per class, so 24 residents total, and we have 2 chief residents who have graduated afterwards. This year we have 1. And our program is unique in that we switch between medicine and pediatrics every month. So it's 1 month medicine, 1 month pediatrics. It helps us to really integrate our experience.
My name is Eric Zuniga. I am a second-year resident within the internal medicine and pediatrics program here at USC, LAC USC program. So right now I am a second-year resident within the program. I was born at the Women's and Children's Hospital, which is down the street. It's now a closed hospital, but in its heyday, it had the highest birth rate in the country. And during that heyday, that's when I was born. I grew up in South LA, South Los Angeles.
We spend the vast majority of our time at LAC USC. That's the general hospital. Other people just know it in the community as the general hospital. So the vast majority of our time is there. And we do some rotations at other centers. So at Keck, USC, the university hospital, we do rotations, as well as a couple of rotations at CHLA. We spend time during our first year for internal medicine and pediatrics in the ER. And during our second year, we also spend time there for pediatrics as well. MedPeds in general, we get the advantage of knowing so many different parts of the hospital, spending time in both parts of the ER as well as on many floors throughout our hospital. Many of us are drawn to this program because of the mission. We call it a mission-driven program, and that's because even at the traditional entrance of the general hospital, you'll see this inscription that basically describes that we will take care of anyone of the vulnerable, whether they can pay or whether they cannot pay, and basically make sure that they have their best chance at life and health. If you talk to many people about why they came here, it's because you can feel that in the atmosphere. Our program director, our fellow residents, and the patients that we serve, you can basically feel that in the atmosphere of our program. That's definitely why I came. I remember being really excited during my interview day. I came here, I met residents who were talking about recent activism and advocating for their patients. I heard about the Patient Care Fund, where it's basically a fund where you can be a little more creative in terms of what people need, and whether it's having a farmer's market for patients that now happens every Monday. That was an idea originated from one of our residents. As well as things like somebody really has a specific need, they have to get really far away to go back home, and I've seen us use that funding to help somebody travel really far to get back to their family. I've seen us basically tailor some of our services to people's really specific situations. A lot of programs and a lot of residents really come into medicine to help people and to serve the underserved. Here, because we spend so much time at the general hospital, we see such a variety of social complex issues, and on top of that, complex medical care, and you figure out how to balance the two and offer the best for your patients. I feel like it's a skill, it's like a muscle that we're building every single day. And I look at the leadership, I look at our MedPeds faculty and see them do that every day. It's something that I'm really inspired by all the time. Right now I'm on internal medicine wards. It's a traditional system where I have an attending, a resident, 2 interns, and a couple of medical students. And we round all together and figure out the best plan for each patient. Some other features that more specific to our MedPeds program is we have a continuity clinic that's internal medicine and pediatrics combined. So it's nice, it's staffed by all MedPeds attendings, It's a place that we as co-residents get to see each other very often. And with internal medicine, a lot of the vast majority of their rotations have a +1 week. So it'll be 3 weeks of that inpatient service, 1 week of a mix of subspecialty clinics and your continuity clinic. And it kind of tucks a golden weekend into most blocks on medicine, which is really good, really good. We all basically have a meal plan where we each get a certain amount of funding each meal. So it doesn't expire, it doesn't run out at the end of the year. We don't have to worry about food. Same thing with parking. Meeting the people here on my interview day, it was really unique. I felt the most comfortable here, especially at the dinner before the interview. Everyone I talked to seemed to really come to medicine at a point of view very similar to my own, where if we're gonna be able to learn these skills of science, offer these great services, how do we combine that in a very socially complex and really flawed healthcare system with limited resources, and where do we want to go from there? What I'm interested in being a med-peds hospitalist, and my goal is to work either in a low-income community or do global health. So I was really interested in learning how to maximize those skill sets as a resident and really feel like I'm serving along the way in my training. You talk to other people and they all have very different career paths, but a very similar vein of how they want to serve as they go along and what they want to do.
What brought me here was just I really wanted to come back home in more ways than one. I wanted to come home because this is my home. My parents are here, my family's here. But I wanted to come home in the sense that I wanted to serve a certain population. And the certain population that we have here, at least at the LA County USC Hospital, is largely a Latino population that's Spanish speaking that are very similar to my parents when they arrived back in the 80s. And every time I have the opportunity to come across a patient, I think back and realize that this could be my mom, this could be my dad, this could be my uncle. And no other place could afford me that opportunity besides here. So that's why I'm here.
The people who should come here, they have to want to work hard. They might see a challenge and they want to put into work to overcome it, to work with limited resources, to really think critically about how to serve someone, for example, who might be unhoused or have an addiction, or a child in a foster care system that has had different caregivers, but you're trying to manage one medical problem or psychiatric problem. And we see the consequences of whether it's poverty, whether it's inadequate access to quality healthcare, or limitations based on insurance, or even limitations based on documentation status. And you have to really have the passion to want to work through those issues and even change some of those issues. Many of our co-residents do advocacy. We have a union amongst the residents called CIR, the Committee of Interns and Residents, and the majority of our residents are a part of the union, and even if you're not in it, everyone gets the benefits of them. But they do some advocacy work as well, but other of our co-residents do it through AAP or ACP. Some people work on advocacy just through academics and research and basically asking and investigating the right questions. We have the ACT clinic. Basically, it's our adolescent transitions clinic that helps folks. It has a lot of different sub-clinics in it, but there's anything from LGBT health to helping transition those who have chronic medical problems who are now like 18, 19, 20 and are trying to get transitioned into adult care, but they do primary care there. We also have some clinics for those in foster care, so the hub clinics, and we meet a lot of children who go through the foster care system. So they have primary care through that we can do rotations at. They also have the VIP clinic, it's called the Violence Intervention Program. And on the peds side, those are some of the highlights. On the adult side, some cool clinics we have are the Adult Congenital Cardiology Clinic, where you can see adults who have survived some really difficult heart or structural problems and see where they're at now. Diversity is really important to many of the residents here, and we actually have some new programming that's getting started up So one of our residents is really involved with affinity groups. It's a new LAC USC program, basically hubbed under wellness, to say that these are places that people can feel safe in communities that they identify with. So that's anything from Black and African American to Latinx, LGBTQ, women in medicine, and more. And people can be a part of multiple groups, and it's really a safe place to find community. Current second years is working on a parallel social justice curriculum to be going on to teach medical residents about some of the issues that might disproportionately affect our communities, and really empower people and give them tools for resources for those problems. So whether that has to do with poverty or drug use or homelessness, whether it has to do with language, and just being a little more culturally humble in certain instances, or whether it's just knowing about what it means to be in LA and what do we have in Los Angeles for the people of Los Angeles. So that's definitely in the works, and I'm excited to see how that turns out. Our faculty are very, very approachable. So our program director, Dr. Breck Nichols, he's really kind, he's very friendly, and he's very, very caring. So I remember as an intern, I was on one of my first rotations, and I just look, and Dr. Nichols comes in literally just to check on me. And I found out that he'd sought each one of us out just to see how we're doing, to see if there's any issues. And I know in different cases when there's been family emergencies, when there's issues, we can text our program director or APD anytime, and they're very, very responsive. We have feedback sessions, and we see a lot of our faculty, especially those who staff MedPeds Clinic, they're fairly recent alumni. So there's a range of years, but they're all very, very approachable. They help us, some of them are helping out with some of our passion projects as well. So it's really easy to find mentorship just by speaking out your interests, and they kind of latch on to us. There's people who go into primary care, which is a common MedPeds destination, and some people go into specialty care. So for example, we have a couple people in our program who plan to do congenital cardiology, and one of our recent grads just started adult cardiology fellowship here, so really excited that she's staying. Some people have gone to do QI fellowships after this, and one of our, there's an alum in particular that went to Kenya right after his MedPeds residency, worked there for many, many years, and worked with adults and children. He actually is coming back, not to LAC USC, but to the US to get formal critical care training, because he's noticed that that's something that's a useful skill for him. But we have people who do fellowship, people who say primary care, people that go into hospital medicine, and everyone that comes in and says, this is what I want to do, they do exactly what they want to do. They go to programs all over the country, and many of them stay in Los Angeles. So I feel totally set up to go to my next steps, whatever direction that is.
If you are the type of individual who is not just interested in a career in medicine, but you're interested in a career in medicine where you find yourself wanting to serve societal needs, but very specifically, if you want to address the socioeconomic disparities that manifest themselves into adverse health outcomes, this is the program for you. This is the program where you have the ability to really be an advocate, be a good listener, and serve a role where you have the opportunity to make long-lasting change. So if you're if medicine to you is only medicine, if you have the ability to really tackle some of those socioeconomic disparities, and you're interested, and you would find that your career, your profession as a doctor will never be fulfilled unless you have the ability to tackle those things head on, then come to this program, because that's what we're about. Every single individual that is in internal medicine and pediatrics at USC has a passion for wanting to improve our healthcare system, to serve this population, to the best of their abilities.
Once you've done a residency or a fellowship here, you are ready for the next phase of your career. And that might be going into clinical practice, it might be going into academia, it might be going on for more training. Whatever it is, be assured that you are going to be the most well-prepared person possible for that next part of your career.